And good evening, and thanks for joining us for this special edition of 23 ABC News Coronavirus Q&A. Tonight we are going to be broadcasting this special edition of 23 News. The regular news will not be seen as we try to dig deeper into coronavirus here in our local community. Now, this all comes on the heels earlier today of a big announcement from the Kern County Department of Public Health. Matt Constantine holding a press conference earlier today that an out-of-town resident has tested positive for COVID-19. Matt Constantine, the Director of Public Health, said that patient is currently self-isolating at a home. There were 5 other contacts, as he called them, in the house that are also being assessed. And officials with the health department are trying to determine who else this patient may have come in contact with.
If there was a concern where the public may have been exposed and the public needs to know for the protection of their health, then we will go public with that information.
Due to privacy laws, he wouldn't expand any more on that, but did say the current prognosis for this patient, he said, was that his situation has improved. Now, joining us in Studio B tonight, we have gathered many medical professionals from our community, and we are very glad and honored they took time out this evening to join us here in Studio B. Let's introduce them for you so you know who is who here. Tonight, to my left, right in the back row, Dr. Dan Erickson from Accelerated Urgent Care. He is joined by Dr. Hamel Kathri from Dignity Health. Also, Dr. Mahtab Singh of Good Samaritan. Down front, we have Dr. Ronald Reynoso from Adventist Health and Dr. Paula Ardron from Kaiser Permanente. Welcome to all of you. Thank you for coming in. We appreciate it.
Thank you.
First of all, the first case officially announced, although technically not a Kern County resident, the first case here in Kern County. Were any of you surprised it took this long to get diagnosed? Ken, why don't we start with you?
No, because we just started testing a week ago, so we haven't had a lot of time to do testing. As we have more and more time to do testing, a lot more cases will show positive. In the next week or two, you're going to see the cases start rising because the testing is now readily available and Quest is getting efficient at processing the swabs.
Dr. Kathri, would you please just give us a quick little recap, not getting too deep, for those people out there that still might be confused when it comes to the COVID-19. Quick history lesson, coronavirus has been around for a while. This is simply a new strain?
Correct. So the initial name was novel coronavirus, being that it's a new coronavirus. It was typically always seen in animals, first time been seen in humans. And as you well know, first started in Wuhan, China, and then it's kind of come across and here down to the United States. And as of yesterday, there were 7 cases in California. 7 deaths, and I think, unfortunately, we will see a surge in that, like Dr. Erickson said. As we keep testing, we will find more cases.
Dr. Singh, not everyone, correct, exhibits any signs or symptoms if they happen to come down with it.
Yes, it's some people are carriers, and some people do have signs and symptoms. It's like the initial come like a flu symptoms, upper respiratory tract symptoms, cough, sputum production, fever, chills, body aches, and then later on, people who are at high risk, people who are elderly, 65 plus with diabetes, multiple lung issues, patients who have asthma, COPD, who have kidney failure, cancer patients, immunocompromised patients. Those are the patients who are at risk, who eventually need some kind of intensive care unit or at least telemetry floor when they are really sick.
Dr. Reynoso, if you could, when it comes to COVID-19 as compared to the regular flu, a lot of people have said it's a version of the flu. I'm going to get it, I'm going to get over it. What makes this, worse than, say, the flu strains that we see going around every year?
Yes, to begin, there are 2 different type of viruses, and for that they behave differently. What makes them different, or at least for the COVID-19, is that it seems to be more lethal for certain aspect of the population, elderly, and that is immunocompromised. So that's the difference. The flu tends to attack the whole spectrum of the population, concentrating more on the young and the old. This virus attacked mostly the elderly population.
And Dr. Ardron, what is probably right now at this stage, because as you've all been alluding to, we're sort of in the infancy of this entire thing. What's one of the biggest misconceptions out there that you've heard about this when it comes to COVID-19?
I think that there's a high fear factor of what can I do? What if I get this? So I think the first thing that people really need to think carefully about is how they can protect themselves and how they can protect their families. The CDC has talked about hand washing, making sure you cover your cough with your elbow, not touching your face, particularly your eyes, your nose, your mouth, and not hugging or shaking hands. Those are probably the most common ways that we spread most viruses. And if every family did just those 4 things, we would decrease the infection rate by about 6 million infections. So sometimes we think about things that are really fancy in order to help us get through a pandemic, but we forget about the things that are really common that each of us can do to keep everyone safe.
Now, this is open up to any of you. You're welcome to jump in on this. When it comes to this particular virus, COVID-19, compared to a regular flu strain, this is what many people, some have called it a super bug of some sort, where it can live and survive on different areas. How different is that from just the regular flu strain that we see every year going around as far as being contagious?
So I think, it is very much like the flu, except it's a lot more virulent. It spreads a lot easier. It hits you and your symptoms are a lot more severe. But it acts like the flu. It has similar symptoms to the flu. You know, the fever, the cough, the runny, not necessarily the runny nose. This does come with shortness of breath as well, because it primarily affects the lungs. So some similarities, but there's also a lot of differences. But like the doctor was saying, you know, doing these simple things that we've been taught to do as kids will help prevent passing it from family to family and also contracting it yourself.
But like what a regular flu strain we see every year, be able to live, I mean, we were just talking about, on plastics, on metals, that kind of thing. Does that also exist, or is it specific to this COVID-19?
No, they both can live on multi-surface. One of the new facts out is that our immune systems haven't seen this before. So we bring it into our system and our body says, I haven't seen this before. I don't have antibodies built up. I don't have a system to deal with this. So it hits you harder than, say, a flu would. My body saw flu last year, a different strain, but it knows how to process it. When it sees COVID-19, this is a new process. So it hits you harder and our immune systems are learning how to deal with it because it is a new virus.
I think another factor that's really important is that virulence. So what that means is if the flu might have a fatality rate of 0.1%, this particular virus is approaching 2 to 3.4%, so at a lot faster clip. And if someone has an exposure to it, they're more likely to expose 2.5 people for every exposure that someone has. So it can spread. But I think what we need to make sure the community understands is that the younger people in our community are more likely to have milder disease. And so they shouldn't panic in that regard. We really need to protect those patients that are 60 years of age or older.
Currently, it's listed as low risk. You know, our risk factor right now. Should we be looking at a higher risk right now, even if we are considered low risk, Dr. Singh?
It is considered low risk infection. We don't have a data much, but I can say up to 80% people can be carriers, also have mild infections. You know, have upper respiratory symptoms, cough, fever, mild fever sometimes, you know. Sometimes they are asymptomatic also, they are carriers. But those are the people who can spread this infection.
Okay.
You know, when you sneeze, the droplet go up to 6 feet. So you are vulnerable to get that infection. So always, as doctor told you have to cover your sneeze. You know, that's the easiest way which we can do. And
we've been asking people, you can go ahead and submit questions on Facebook. We're taking them right now where we're streaming this also live, and we will get those questions in. We had some questions that were already posted from a question that we had before, and I'd like to bring up one right now. This is from Andy Campos, and any of you feel free to jump in. A lot of rumors out there about possible people that have tested positive in the Bakersfield area. We've heard this several times, that there are people that have tested positive. They're currently being treated at somewhere in Bakersfield, and they're not being told about it. True or false?
Absolutely false. One of the things is our public health department is on this. You know, everyone is watching every single case that's identified.
So let's break it down from that aspect. One of you are examining a patient who you believe has might be a carrier of the coronavirus. The testing comes back positive. What is the procedure and process that goes in that gets it to the health department where they're, because Matt Constantine said if it's out there, we're the first to be notified.
Right, and that's what the infectious, we have infectious prevention people in our hospitals, and that's what their job is to notify them first. Then they notify all of the exec team, and then the patients, and it goes out from there.
Okay, let's jump into another question if we can. We've gotten several talking about this. Let's go to the next one if we could, Esteban. Here's one. Testing for the virus is still being sent out of Bakersfield. Now, this is someone that just by reading this, you get the impression that they know something. How long does it take to get the results back when the testing goes out, and when will Quest be taking over that testing?
The typical return time is 3 to 4 days.
3 to 4 days.
That's what is expected for the test at this time. I mean, there are other companies in the state trying to expedite that, but that's what we have from Quest right now. You can get the test around that time.
And Dr. Erickson, do you expect that time frame to expand with more tests going out, with the start of mass testing tomorrow?
Yeah, Quest is developing their efficiencies right now. So
Okay.
when you send the nasal swab, it's a little vial with a little pink molecular assay at the bottom. It's got 3 glass little balls that work as agitators to get the virus in there. We've had these same vials for a long time. We use them for different viral tests.
Okay.
So we take that, we send it out. Quest is turning around tests between 1 to 3 days. We're seeing it come back, but why we test them, we call them a person under influence. And we basically tell them, we're treating you as if you have it because you've screened in as a likely candidate. So we call them a person under investigation. We send a form. We contact the CDC and the Public Health Department. We let them know this is a person under investigation. And then we send them home with guidelines saying, stay home, stay away from people, stay out of hospitals, don't visit the elderly, basically isolate. When you get the test result back in 1 to 3 days, if it's negative, then we would stop that. If it's positive, then we're going to quarantine them for about 14 days. So we have all this data we give them. And then we also contact the agencies and let them know we're watching this individual so that they can watch with us. And then as they're positive, we report the positives, and that's how they can figure out where the pandemic is moving in Kern County.
Talking about that sort of testing and someone feeling like they've gotten to that point, Dr. Ardron, you're sitting at home, someone's sitting at home watching right now, and they think they may have the symptoms. Many people, maybe not wanting to go the extra step to go and get tested. At what point does a red flag get raised when you're sitting at home that you need to go get checked out by your physician or by a doctor?
So there are different levels that we're actually thinking about, categories of people that we want to really take care of.
Okay.
So someone who just worries that they might have it, but they're not having any symptoms, that's not the person that we want to test. Someone who's having fever and cough, shortness of breath, but they don't have any other special features about them. They're from age or other comorbidities or other diseases, that is not the individual that will want to test for COVID-19. Flu is also happening at this time, and that's probably the most common thing that is going to be causing fever, cough, shortness of breath. The third category is that individual who has the fever, cough, and shortness of breath, but they're in those special categories. They're over age 60, they have cardiovascular disease, maybe they're a cancer patient, or they have HIV, something that is affecting their immune system. That is an individual that we'll want to test. And then as things have kind of evolved over the last few weeks, the last category is fever, cough with shortness of breath, people that have had recent travel in the last 14 days. And that travel could be overseas travel, but it also could be from Seattle or places that have been hot spots in the US. And then people that have been exposed to someone who is a confirmed case of COVID-19. People in that fourth category, we definitely want to test.
Dr. Reynoso, there's been a lot of speculation as to how many people, when this whole thing is over, just in Kern County, not in California, but just right here, may actually have been exposed or perhaps had COVID-19 and never realized they had any symptoms. Is that number, I mean, if you were to guesstimate, are we talking in the hundreds or the thousands of local residents?
We cannot just speculate. That's a number that we don't know. As Dr. Erickson mentioned earlier, the more we test, the more we're going to find out. The expectation is if we do this right, the way we're planning and doing it, that we're going to have an increase on those numbers.
Okay. We do have a question that was just sent in through our Facebook Live, and let's bring that up right now. This was one of the previously submitted. Let's do this one. How does it affect pregnant women, and what about anyone who's had valley fever? Would anyone like to jump in on that one?
Well, for pregnant women, we don't have much information that is available at this time. There's a lot of guessing in there. As more information comes from China, Europe, and the US, we're going to know more about how this affects the fetus and the mother, but there's not much information. But the way you have to approach it is the way you will approach any pregnancy. That any infections can be at risk for the baby and the mom.
Okay. What about getting that test from a physician? There was talk when this first kind of started that there were many hoops to jump through. Things have been streamlined. Dr. Singh, how has that process been streamlined to get someone who's maybe come in to see you to get them into the test they need?
So basically, I work in the hospital as a hospitalist. So patients do come in the hospital. For example, patients who have some kinds of symptoms, they initially land up in the emergency room, where they have symptoms of cough, sputum production. So ER doctor, so we will make sure they discuss with me or discuss who's our on-call hospitalist, okay, whether we need to screen him for this COVID-19 or no. Then from there we go from there,
Okay. Dr. Copley or Erickson, if you have it once, can you get it again? Are we at that point being able to tell when it comes to this?
I don't know the answer to that. I know I was speaking with Dr. Erickson earlier, and we were talking about how people that have it, when they keep testing them, they do keep coming back positive. But I don't know the answer if you can get it again. I don't know. I'm not sure if anyone else does either.
Typically, similar to the flu, most of the time, I'm just using flu as an example.
Okay.
Most of the time when you have the flu and you get through it, the flu in the later portion of the year, when the virus changes, it's weaker strains. So even if you get it again, it's a weaker response. So we don't know if you can get corona a second time. What we do know is some of the cruise ship people that were isolated, they were testing them for up to a month, and they were still testing positive. They were still shedding the coronavirus. So we know it's the prodrome, the time of disease is lasting longer than, say, the flu. But we don't have enough data to know, because we've only been through one season, can you get it again?
There was another person that had texted and asked about finding a vaccine. Obviously, it takes time. Is there any time frame that any of you have heard of when it comes to that, developing something to fight this?
Well, so far what is being said on the medical field is that it might take a year. Hopefully we can get it sooner. We have the US and Europe working on that, but it's going to take time because we have to prove that it's effective and it's safe, and do all the process. Even though they are being expedited, it's going to take time.
All right, now I believe we have that question that was just sent in by Facebook Live. Let's see if we can pull that up right now and ask that next one. Is it ready? There we go. How does the weather affect the virus? We've heard a lot of people talking about this, that being here in Kern County and Bakersfield, oh good, we've got the heat coming this summer, and the heat can kill the virus. Fact or fiction? Dr. Ardron?
I think we don't know. We
Okay.
haven't really seen the arc of this. I think when it comes to influenza, like those colder environments, we're huddled closer together. It's easy to jump from human to human. But we don't know about the coronavirus, and whether or not the temperature going up is going to make it safer for us. I think time will tell. But I think there are a few things that are unique about Bakersfield and Kern County that might make it easier for us not to have this spread as much. A lot of the major cities that have had big problems have intense public transportation that's really been utilized, and that's a fast place for things to spread. They've also been densely populated, which Bakersfield isn't, so that works to our advantage as well. You don't have people on the streets walking from place to place, like work to grocery stores, like you do in New York City. And so I think that our community should really feel at ease about the fact that not living in a highly densely populated area is actually an advantage for them.
And I know that this is hard to predict because it can spread in various forms, whether it's on clothing or, as Dr. Singh, you were mentioning, the sneezing and whatnot. Is there a specific time frame that you could give the people that are watching as to the shortest time it can live on a particular surface or being to the longest it can live? Are those time parameters known when it comes to steel, Dr. Erickson?
I don't know. I've heard different numbers.
Okay.
I've heard it can last in the air for up to 3 hours. I've heard it can last on surfaces. I haven't seen the data myself, so I'm listening to Dr. Fauci and different experts that are telling us how long it can live. And I think the most important thing is what do you do? And how do you protect yourself? And so the hand washing, the 20 seconds, sing happy birthday, we're using a lot of face masks and personal protective equipment. I think the most important thing that people know is if you're going in for a medical examination, it's a good idea if you have a face mask, if you're coughing. So I think that's the important thing, because we're not sure exactly how long it lives, but if you're coming into one of the testing centers, make sure if you're coughing that you're covering that so you're not spreading it when you're amongst other patients.
It sounds like, Dr. Reynoso, that there's still so much about this virus that we don't know, that we're going to be continuing to learn new things as the days, weeks, months go on. Is that right? Is that
right? That's correct. I mean, it's a novel virus, so we have never encountered this type before, so there's a lot to learn from it. And it's going to take us time to get to know it in a good manner.
I'll go with Dr. Singh. Do you expect, now that the testing is available and that people know that mass testing is going to be available beginning tomorrow, are you already thinking about seeing an uptick in the number of people that come through your doors looking for testing?
Yes, people do call me, and a lot of people are coming now. Actually, testing is available, as doctor told. Down the road we will expect more positive cases since we are doing more tests now. So people are getting more aware, but we need to make sure that, as doctor told, wash your hands, cover your cough, at least 20 seconds. That can prevent. We need to prevent and make the graph not peak, flat.
We have another Facebook question. One of the things Matt Constantine was telling us earlier, that they were monitoring 30 travelers, people from our area that had traveled outside, and there were 84 people that they were notified through their own healthcare position. And how does Valley Fever, didn't we already do this one from Kristen? How does Valley Fever, well, how about this? Does Valley Fever, does any other, I mean, we know that pre-existing conditions that you had talked about, certain respiratory conditions, people that have had other things, but things like Valley Fever, do we know if Valley Fever would?
Yes, we don't have much data about this, but since Valley Fever is also one of the lung condition which is common in Kern County, and I think people, they are more risky,
So someone who may have had Valley Fever could be 5 years ago, 10 years ago?
And for instance, if you have pulmonary fibrosis, if you have decreased lung function or decreased ability to aerate the lungs, you're going to have more of a propensity to get pulmonary infections. So I think if you've had any type of COPD, any type of really bad scarring from coccidiomycosis or Valley Fever, that's going to predispose you to having lung infections easier than someone like yourself that's never had that.
Do you think more needs to be done right now as far as trying to keep people in their homes and limited even more? Because even out today, running around, I was out on the road driving home before coming back here, and there were cars everywhere. People still seem to be maybe taking some of this seriously, but still going about their normal everyday business. Because of this contagion factor, do more people need to be taking it seriously when it comes to staying at home?
I think so. I think, there is a little bit of unknown here. And, is there a lot of hysteria? Possibly. But I think what we've got to do is we've got to be more cautious. And I think, we've talked about staying away from larger crowds, more than 250 people. A lot of people have canceled meetings. Now we're even talking about groups of 10. We don't want to put people in groups of 10 together. So I think this is a way to contain this virus. without letting it spread more. So I believe, staying at home, staying away from crowded areas is definitely a smarter thing to do.
And as far as the different facilities that you're in, trying to mitigate those crowds, Dr. Reynoso, is there anything in particular that you're doing?
Well, like Dr. Catherine mentioned, for us in Adventist Health, we're limiting any meetings that is for 10 people or less, and not to have any meetings that are not necessary. We're trying to do them using technology, so you can do them by Skype or by phone, so that keep minimizing the opportunity of spreading this disease. Plus, you can educate people and send a message to the community that we need to do that social isolation that is needed to decrease or flatten the curve of the spread of the disease.
Now, I'd like to have each of you leave our viewers with one thing in particular, if you could, and I know that it might be several of you might say the same thing, but Dr. Ardron, if you could begin, what should people here in Kern County, if nothing else, take away from COVID-19 and where we're at right now with that?
I would like to leave them just with the thought that there are things that they can do to protect their families. They're not helpless, and that their medical community is here to support them. And there are lots of ways that we can do that. Dr. Reynoso was talking about decreasing meetings. We've also been seeing patients by telephone appointment visits, telephone consults, so that it helps us really triage those people that need to be tested and brought in without putting people at risk in waiting rooms or other places. So really just understanding what you can do to keep your family safe and just focusing there.
Dr. Reynoso?
One of the biggest things that they can do is keep calm. Yes, it's good to be knowledgeable about what's happening, but don't succumb to fear. Follow the advice of washing your hands and using hand sanitizer if you don't have the ability of soap and water, and avoiding the large crowds. And follow the advice that is getting through the medical community, your physician. That's the best way.
Dr. Singh?
I'll suggest so for the community, we are here for them. We are always there for community. We will fight this together. We will go through it. I want to tell community, just stay calm. Follow doctor's advice. We will go through it. That's it.
Dr. Catherine?
One of the things that we're doing as a health system, we're pooling our resources. Dignity is working with Adventist Health, with Kern Medical. We're on calls now twice a week. We're working together to see how we can, find people that we can send to Dr. Erickson to get screened, how we can, treat them in certain areas of our hospitals. If we don't have beds, where are we going to put them? So we're working together as a community to help resolve this issue.
And Dr. Erickson?
Well, we've been working for the last several weeks on a 10,000 square foot COVID-19 testing facility. So we set it up specifically so only patients that are, patients under investigation are going there. Okay. So we're really trying to set up a center where people can come, and we're going to test them in a safe environment where they're going to be in their car waiting, then they're going to come inside, be reviewed by a physician, make sure there's no other medical conditions we need to be treating, and then testing them for COVID without exposure to a waiting room. There's no exposure to a waiting room, and we have large capacity. So that's kind of how we've tried to support the community and say, this is a brand new area. It's never been used, so it doesn't have a lot of microbial content in it. So we're hoping that will allow, some of the hospitals have given us supplies so we can really test patients in a safe environment where they're not around other respiratory secretions in a waiting room, for instance.
Somebody out there is sitting there thinking, I believe I need to get tested. They still need to go to their doctor first. That's where it has to start. Is that right or wrong?
Their primary doctor doesn't want to see them. Actually, I've gotten a call from 5 primary doctors who say, please, my waiting room is small. I don't want COVID coming in here. Okay. So I've said, okay, we have a COVID-19 testing with a separate private entrance, and people will be coming directly in from their cars, so there's no exposure. And so
they can get pre-screened there.
And then once they're negative, then we can send them back to their primary doctor to follow up. But I think the screening is better in a facility that isolates them.
And that all begins tomorrow?
Yeah, tomorrow we're open for testing at 212 Coffee. We'll have two big red tents out front where you come up and we send you either to urgent care or to a private COVID-19 entrance. You get a wristband and a number, and then we put you in your car and we bring you inside to see the physician one at a time so that you're not exposing each other to your virus.
Okay, and lastly, are we looking at a couple of weeks or are we looking at a couple of months of people having to adhere to more strict guidelines when it comes to interaction?
The reality is that we don't know, and we just need to see how things evolve as things goes, and just keep yourself informed through what the community is letting you know and the public health department.
Dr. Erickson, Dr. Khattri, Dr. Singh, Dr. Ardran, Dr. Reynoso, thank you all for coming in. We appreciate it.
Thanks
and
for
sharing
us.
your knowledge.
Thanks for having us.
Thank you.
All right, we'll be right back. We're going to come back and be talking with a number of hospital executives about what's going on in their facilities to help with this. You're watching a special edition of 23 ABC News Coronavirus Q&A.